Black lung disease, also known as coal-workers pneumoconiosis, CWP, is a type of pneumoconiosis that develops due to long-term exposure to coal mine dust. The fine coal dust particles scar lung tissue and make it difficult to breathe over time. Some of the primary long-term effects of black lung disease on a patient's health include progressive lung damage and scarring. Black lung disease causes progressive and permanent damage to lung tissue as fine coal-on-silicate dust particles are inhaled over several years or decades of occupational exposure. The tiny dust particles can become trapped deep in the lungs, causing inflammation and fibrosis, scarring, of lung tissue which worsens with continued exposure. Loss of lung function. The lung scarring and tissue damage caused by black lung disease leads to the progressive loss of lung function over time. Patients experience decreasing ability to breathe, a reduced capacity of oxygen intake, CO2 removal, and lower lung volumes which can range from mild to very severe depending on exposure levels and individual factors. Spirometry tests usually show reduced lung function parameters like FEV1 and FVC. Shortness of breath. Dyspnea or shortness of breath is one of the hallmark symptoms of advanced black lung disease and worsens as lung function declines. Even mild activities like walking or climbing stairs can cause shortness of breath. In severe cases, patients may experience shortness of breath even at rest. It is a lifelong and debilitating symptom that does not improve. Chronic obstructive pulmonary disease, COPD. Many patients with black lung disease go on to develop COPD, an umbrella term used to describe chronic bronchitis and emphysema. This happens as inhaled coal dust and trapped particles continue to damage airways and parenchymal lung tissue over many years, leading to obstruction. Patients experience worsening breathlessness, chronic cough, sputum production, and susceptibility to respiratory infections. Cor pulmonale. In later stages, the right side of the heart may enlarge and fail due to increased pulmonary pressures from severe long-standing lung damage. This condition, called cor pulmonale, happens when the heart has to work harder to pump blood through the lungs compromised by black lung disease. It can lead to edema, liver dysfunction, and heart failure if untreated. Pneumonia risk. Damage to lung tissue and loss of clearance mechanisms increases susceptibility to pneumonia in black lung patients. The recurring pneumonia episodes further impact respiratory function, oxygenation, and quality of life. They may require frequent hospitalizations, especially in older patients. Disabling symptoms. Advanced black lung disease and complications like COPD can be totally and permanently disabling. Patients experience crippling shortness of breath, even at rest, along with chronic cough, fatigue, and decreased exercise tolerance. Basic activities of daily living like dressing, feeding, toileting become difficult without assistance. Sleep-disordered breathing. The reduced lung volumes and recurrent inflammation puts black lung patients at high risk of sleep disorders like obstructive sleep apnea. Sleep quality deteriorates due to nocturnal hypoxemia, dyspnea, and recurrent awakenings, which further compound daytime symptoms like fatigue. The lack of restorative sleep adversely impacts quality of life. Accelerated aging. Research shows markers of premature aging in coal miners due to years of dust exposure and inflammation. Black lung disease accelerates multimorbidity, functional decline, and immunosenescence, resembling accelerated aging. Studies find a 3 to 10-year age difference in physiological measurements between coal miners and control groups. Psychological effects. The disabling symptoms, isolation, fear of disease progression, and work disability often lead to anxiety, depression, and social withdrawal in black lung patients. Cognitive changes may occur due to chronic hypoxemia. Dependence on caregivers, family also negatively impacts mental well-being and relationships. Mesothelioma is an aggressive type of cancer that develops in the protective lining of body organs like the lungs, heart, or abdomen. It is caused by prolonged asbestos exposure, typically decades ago. Some of the long-term health effects of mesothelioma include disease progression. Mesothelioma almost always worsens over time despite optimal treatment. The median survival duration is 9 to 12 months and 5-year survival rate is only around 10%. As it progresses, patients experience worsening symptoms like dyspnea, chest pains, fluid buildup, weight loss, etc. Recurrence risk. Even after exhaustive therapy, the cancer has a very high rate of recurrence either locally, in regional lymph nodes, or at distant sites in around 50% patients within 2 years. Each recurrence further impacts survival time and quality of life. Severe symptoms. Advanced mesothelioma causes extremely severe and sometimes disabling symptoms that continue worsening till the end stages. Dyspnea, chest wall and bone pains, facial swelling, neurological changes greatly reduce functional abilities and necessitate intensive supportive care. Shortness of life. Mesothelioma exerts a profound psychological burden due to the poor long-term outcomes associated with the diagnosis. These patients face an uncertain future of several months or at best a few years at best despite aggressive multimodality treatment involving extensive surgery, chemotherapy and radiotherapy. Treatment side effects. All anti-cancer therapies administered over months also take a toll on health. Besides short-term effects like fatigue, nausea, risk of infections, some side effects can persist or become chronic like peripheral neuropathy, renal dysfunction, radiation pneumonitis, etc. These contribute to poor quality of life. Functional impairment. As the disease spreads to involve more areas and recurrence occurs, long-standing chest pains, recurrence at vital sites like the brain or spine can permanently disable motor or neurological abilities. Patients may require permanent oxygen therapy or assisted care at home. Multimorbidity. Mesothelioma patients tend to develop additional long-term health issues due to aging, therapy, functional decline, which further complicate management quality of life. These include heart disease, diabetes, infections, pressure ulcers and bed sores requiring prolonged rehabilitation and hospitalizations. Black lung disease and mesothelioma impose massive lifelong health burdens on patients and their families. While black lung disease damages lungs slowly over decades of exposure, mesothelioma progresses rapidly with a very poor long-term outlook. Both conditions lead to permanent loss of lung function, multimorbidity, disability, months or years of debilitating symptoms, psychological trauma and unfortunately, premature death despite best available treatment. Early detection, prevention of all occupational exposures and continued innovations in targeted therapies remain priorities for minimizing the detrimental long-term health consequences of these occupational diseases.